The first trained nurse in America was Linda Ann Judson Richards. She was born in 1841 and lived until 1930. She was born in New York State and resided with her parents. At the age of 13, her parents developed tuberculosis, and Linda helped care for them until they died. She then lived with her grandmother. Subsequently, she also cared for her fiancé, who was injured during the Civil War. Between caring for her parents and her fiancé, this really provoked Linda to go into a nursing program. She loved caring for people, and so she attended the Grand New England Hospital for Women. She graduated from there in 1873. Linda saw a lot of changes in her lifetime. She lived during a massive population growth. New technology was advancing, and there were also opportunities in medicine. Some contributions that Linda herself made to healthcare include the formation of keeping medical records and physician orders. She was also instrumental in developing a professional nursing program at Massachusetts General Hospital. Through this program, she was able to learn about the benefits of training nurses professionally, and also prove the fact that nurses who are trained professionally provide superior care to those who are untrained. One of the largest social issues occurring at the time of Linda's life was that of racial reorganization. With a booming immigrant population, there was also a mixing of races. Mixing and categorizing of these populations created an unstable and inaccurate grouping of many cultures of people. It was not until 1930 that a more stable classification of people was settled upon. Shortly after this time, there was no identification of mixed parentage, and by 1940, the term color was no longer used to identify a race of people. In 1840, the U.S. Census increased to more than 17 million people, which was 33% higher than the previous decade of 1830 to 1839. The Civil War had broken out, and we saw an urbanization that created child labor in factories. Just after the turn of the century, there was the influenza epidemic of 1918 and subsequently the Great Depression. This part of history was a great time to live and see the new fashions, technology, inventions, and discoveries, but it was also full of starvation, violence, and death. Healthcare saw a number of changes in addition to what was happening around the world. In 1923, insulin was mass-produced for the treatment of diabetes. Even today, we see insulin as the gold standard of therapy. Over the years, insulin products have become more plentiful, and their properties are identified from various sources and strengths. We also saw the iron lung created back then. It was put into use as an effort to assist patients with polio in breathing. Fortunately, today we have a vaccine for polio, so we don't see that disease anymore. Over time, we have learned the importance of maintaining patient records and physician orders. The quality of health care that's administered is often reliant upon a history of information and previous treatment that's pertinent to each patient. Records provide a pathway of treatment without hurdles, as well as positive end results. One of the most important standards of practice for a nurse is assessment. During this assessment of collecting data, having a history of medical information, it is clearly helpful to obtain and document all of this information into the form of a chart. Nurse Linda was insightful to see the importance of creating a system to keep these records. One can only imagine the increase in efficiency, productivity, patient satisfaction, and positive outcomes that must have come from this task. Today we have trained nurses. They work in hospitals, medical offices, local health department, government offices, schools. It is taken for granted that nurses are professionally trained. When someone is at home sick, they may call a nurse line at their physician office or talk to a nurse at school. There's respect and trust that a nurse can provide care or assist the patient in obtaining care. While it is true that some nurses perform better than others, there's no doubt that nurses practicing today are professionally trained. It is also important to note that as a population, we expect only trained nurses to take care of us. Nurses from years ago who worked for the military or helped during wartime were necessary to meet the demands during that time and for an ill community. Learning new skills on the job and under circumstances that are less than ideal must have presented frustrations as well as opportunities. Administering the wrong medication or incorrectly identifying a patient, misdiagnosing a patient, those are all things that have life-threatening consequences. The stress of working without formal education or professional teaching must have been tremendous. Today, we are pleased with the fact that nurses can be trained in a professional environment and prior to getting thrown into difficult situations. Professionally trained nurses such as Linda Ann Judson Richards are one of the reasons there are professional standards in nursing today. Professionally trained nurses see the need to continue education and teaching. They are responsible for creating organizations, empowering women, and improving the health of their clients. The work that Linda Richards did has far-reaching effects and is invaluable to healthcare today. Thank you.